Hey guys, it's James Oliver and I'm here helping Dr. Wyatt. Last week we did a video asking you guys to ask questions and I would interview him this week. And we had a question come in from Joe. He asked Dr. Wyatt, how much can you bring the lower forward in an adult and how long does it have to be in a forward position for the condyle and fossa to remodel? What say you, Dr. Wyatt?
Okay, thank you for asking this question, and we have answered this in many cases. We started out originally advancing the mandible where people had the condyle was pushed back into this retrodiscal tissue, and we would advance the mandible and that relieved the pressure and the retrodiscal tissue could heal up and they'd get over their TMJ problem. So here's we got a case that has a TMJ problem, and so we advanced her mandible, but since we were advancing the mandible, we thought we would go ahead and let me get this picture going here just a minute. Okay, all right. Here is the lady. She came in with the jaw back like that and had this TMJ problem, and we could just advance it by taking the person, let them move their jaw out where they want to and where the jaw is comfortable. And if you put the jaw in a comfortable position, it will nearly always, the condyle will be away from the retrodiscal tissue. Like you get hit in the mouth here, shoves the condyle into that tissue and damages it, and it swells up, and people have problems with it till they can get it down. Now let's show what she looked like. We could break it out. That's looking at it from the straight on, and here's the way she looked after we had brought the jaw forward. So we figured we could do that, bring the jaw forward, and I've never had any problem with anybody making it hurt by moving it too far forward. But I'm sure there's a distance in there that you can't get past it. Maybe bring the jaw way on out here, but we brought the jaw forward on this case, and let's show you how it happened. Now you see where the jaw is, and this x-ray is not too good, but you can see the lower anterior teeth here, and we're going to move them out there. And that means we're going to move the condyle that much further, so we'd have to go down the fossa, so the condyle would end up over here somewhere, and we advance it like that. And if you hold it there and straighten the teeth and everything, keep it out to that position long enough, there'll be remodeling of the condyle where the fossa and the condyle will remodel and the teeth will stay in that position. But the person has to wear this for several years, and you can't go back and forth and get it to work. So let's just go through this and show what I did. Now we brought the teeth out to like that, and that made the person look much better, and the condyle has moved out of the fossa. It's on out, so maybe the fossa's something like that, and it'll be there. Now the condyle will actually lean backwards, and the fossa will change too, and this will be out there. Now in addition to bringing this out, as you bring the jaw forward, you increase the angle of this. Like it'll go here, and if you stopped here, but it'll increase this gonial angle. It'll get greater, and the neck of the condyle will move backward. But you have to stay there for a long time for this to happen. But it will do this. But you can't go do it for a day and leave it off, and then you have to stay there for it to do that. So here's the lady's case. We brought the teeth that far forward, and we brought the upper teeth back some to satisfy that. It didn't need that much, it didn't need that much distance right here to relieve the condyle. So we brought the teeth back some and brought these forward some, and that relieved the pressure on the condyle pushing against this retrodiscal tissue. Now that makes the person look so much better until they don't mind wearing it. And she had a tongue thrust habit, and we built those to, and added that we had hooks on these teeth back here. You'd have to go back and look at this whole video on this lady. We've got about 100 pictures on her. I'm just going to show a few for showing this. Let me see, I need to get to the condyle. You have to put somebody in a special type of retainer to make it stay like it is. Now over on the left over here, this is a deep retainer. Sorry, that messed up there. Let me see. Let me pause again. And,
there we go. There you go.
now, okay. We had to put a retainer on for the nighttime while the person is asleep. You've got to keep the jaw out there. So you have a retainer that's quite high, and you see it, you know. All right, your retainers, this is a hump like that. So the retainer actually comes down from the front up here, and when the lower teeth hit it, they have to move out to here. And in the daytime, you can wear a short retainer with a very small ramp, and the person looks so much better. They keep their jaw out there in that position. And at night, they have to wear a retainer like this with a ramp they can't get their teeth behind, and that holds the jaw in that forward position. Now we put this little retainer here, but I don't like that. I would rather bond the teeth together and keep that whole thing, because it tends to move these teeth forward a little bit to do it. So here it is. This is a night retainer, and this is a day retainer, and this is one I don't like to use. Just bond those teeth all the way together. And if the person wears that long enough, the whole condyle will shift back, the neck of the condyle, and the fossa will move forward where it works down here. And then this jaw angle down here, the gonial angle, will get bigger. In other words, as it gets bigger, the jaw can come forward like that. So those two things have to change for it to stay there. But if you do it long enough, it'll stay there. And if you just go back and forth, you can look better while you're wearing it, but it can go back. And on some of these people, I've had it get out there and you couldn't go back with it. So I'm going to say goodbye, and if you can advance the mandible whatever it needs to. I've never run into anybody that you had the problem bringing their jaw forward. It was where the jaw was going backwards where we had the trouble. So you can try this, and it works. It just is a long-term thing. The person really, if you make them look so much better, they like to wear it out there, and they'll wear it whether they like it or not. They wear it, and that holds it there. The person then will just, their jaw will be in that position. So thanks for watching, and I'm going to hang up here and close.
Hey, Joe, I hope that answered your question this time. And if you guys have any other questions that you would like to ask, we'll do some future interviews like this if you guys like this. So please let us know, and we'd love to get your questions answered. So as always, Dr. Wyatt hopes that you look at the American Orthodontic Society and join them. And thank you, Dr. Wyatt, for taking the time to answer Joe's question.
Well, thank you now, and we'll say goodbye. I hope you'll join our group and subscribe to our channel. Thank you now.